Ontario has asked a familiar face to help organize the province's health data. Former federal health minister Jane Philpott has been named special advisor to the Ford government to support the design and implementation of a new Ontario health data platform. That's a place for researchers to access information to help with the response to this pandemic. Philpott will also chair a roundtable with health and legal experts to advise the Minister of Health and the President of the Treasury Board. So will this new project, though, help close the province's big data gaps? Dr. Jane Philpott joins us from Markham. Hi, Dr. Philpott. Good to see you again.
Nice to see you too.
I wanted to start off by asking, I had sort of read about this announcement and read my colleague Laura Stone's article about it in the Globe and Mail, but from your perspective, what exactly does the job entail in kind of layman's terms?
Well, this is a project that the province has been working on for several weeks. It's actually something that I think provincial governments have wanted to do for a long time, and that's to pull together multiple health databases across the province, which aren't particularly well linked. And of course, in the face of COVID, it was recognized that a big part of the response is to be able to get the best information, and that information resides in multiple places. And so the province announced about 6 weeks ago that they wanted to put together a health data platform that would pull together all of those databases and be able to provide information to a number of people, including researchers who will be able to study what's going on, but it will also provide information in a timely way once it's put together properly, that will be able to track, for example, who are the people who are most at risk? Are there particular geographic areas that are most at risk? And what more can we actually understand about what the virus is doing, how it's spreading, and where the resources should be? So my job is to provide advice to the ministers, and particularly with my experience having worked not only on the front lines of the COVID pandemic, but also on the front lines of healthcare for a long time in the province of Ontario. It's something that I've recognized a need for, and many other health experts have been calling for a long time.
From your perspective, where are the biggest data gaps at this point?
Well, I think one of our challenges is, as I alluded to earlier, is that the data lies in silos. So you talk to almost any medical expert in Canada, and they will tell you that we have a fairly fragmented system. So we have a whole bunch of information that's in hospital medical records, and we have other information that's in family doctor medical records, and we have lab records, and public health has another whole set of information. And some of the challenges we've known about for a very long time are that the information doesn't flow across all of those. And some of that has led to the challenges that we've faced even in the last few days, where tests have been done and the right people haven't known about those results in a timely way, and that's dangerous. And so the more that those data sets can be linked properly, and we can ensure that there are no data gaps, because each data gap is potentially a person that's falling through the cracks.
Yeah, and it's interesting you use that example, because in that example, it was 700 test results that basically went unflagged in April. And staff at each hospital, it was 2 different hospitals, thought it was kind of the responsibility of the other hospital. And I'm wondering, that when I came across that, I was thinking, wow, how common might that be, right?
Well, sadly, in healthcare, we don't, these kinds of things are always unfortunate. They aren't the norm. And, I think even in this case, as people found out a little bit more about it, they realized that the majority of those folks had found out about their test results, but the early understanding is that not everybody found out in a timely way about their test results. And that's always a huge problem when it happens in healthcare. And that's what a cohesive health database should be able to address. And of course, you can write into your system mechanisms by which there will be alerts that will be made evident to be able to provide information that a test has been done and maybe hasn't had the follow-up necessary.
You mentioned the timeliness of this, and I'm wondering, my understanding is it would start in July rather. How I ask about timeliness only for relevancy reasons, right? So how much might this actually help as the possibility of a second wave of this pandemic, as we face that possibility, rather?
Well, it's a really good question because, obviously this is really important and people are becoming infected every day. People are dying every day. So there's a large element of urgency to get this done quickly, but it also needs to be done right. The sad reality is that COVID is with us for the foreseeable future. We're talking months to years before things are really under control with COVID. And so my advice will be to the ministers that we need to work, they need to work very quickly to be able to get the experts and the technicians to put the platform together. But they need to do it right because this is not a particularly easy task. Many people have tried to do something similar in the past, and it's not always met with the success that one imagines. And so I will be certainly overlooking what's going on and trying to ensure that it is done in the best possible way, given the urgency of the moment.
Before I let you go, Dr. Philpott, because we are talking about data, a large portion of that conversation this week has revolved around how there is so little data in this country and even province by province on race-based statistics, especially where COVID-19 is concerned. And I'm wondering what your thoughts are on that and the fact that we don't have it and whether or not you'll be addressing that in this endeavor.
Well, I don't think one could do this role without addressing that question. It's certainly one that almost immediately comes to mind. And as I mentioned earlier, my role is as an advisor to the ministers based on advice that I also will gather through a round table of other experts. I think you'd be hard pressed to find a health expert who wouldn't tell you that getting demographic data, including race-based data, is absolutely essential. So my advice to the ministers will certainly fall along those lines. This is something that is absolutely essential. In fact, that data is being collected in certain circumstances, but not everywhere. And so there's work to be done to ensure that there's better consistency, that those standards are set so that the right data is collected and that it's accessible to people in a way that will be helpful as quickly as possible.
And a final kind of political question. You didn't run for the Liberals in the last election, but you were a Liberal prior to that. Was there any hesitation on your part about this appointment and the Conservatives asking you to do it?
You know what, I am taking on this role for the people of Ontario. I recognize that there may be an opportunity for me to help, and partisanship it doesn't enter into the equation on this. If there's a job that can be done that might potentially decrease suffering and even save lives, then I want to be there for it no matter who I'm working with.
Okay, I'll leave it there. Thank you, Dr. Philpott. Appreciate you coming on the program again.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.